New innovative technology coming to the Asheville VA will help veterans cope with the effects of PTSD. Today, we got the first look at how this virtual technology will work. And News 13's Stephanie Sanostasi is joining us live tonight. And Stephanie, Asheville's the first VA in the country to get and train on this equipment?
Yes, and it's a incredibly unique opportunity and tool for them. In fact, there's only 13 other VAs across the country that are offering this service to veterans. It looks and even feels real, bringing a veteran back to a specific moment in time, a time most hope to forget.
It's things that we as civilians don't really understand.
But researchers say having a vet relive this will actually be healing for them.
If done in the hands of a well-trained clinician at a pace that the patient can handle, we can gradually help a patient to go back and confront and reprocess very difficult emotional memories, but in a safe environment.
Skip Rizzo works as a research professor. He helped design this virtual reality in hopes of alleviating the debilitating effects of PTSD.
So we could put people in an Afghan village or an Iraqi marketplace or a slum area in an Afghan city. And these were all settings where various trauma experiences can occur.
An organization known as Soldier Strong donated the software. They hope by giving veterans in Asheville access to this, it will help reduce the number of veteran suicides. A tool innovation specialist Ann Bailey says she's excited to see come to life.
This is an opportunity for our patients to have some very veteran-centered, veteran-focused therapy to help them deal with coming home from war
and coming to terms with their new reality.
I think it's an important step forward because in addition to the scientific evidence for its usefulness as a treatment, it may also be a way to engage digital generation service members in treatment in ways that they might not ordinarily seek with traditional talk therapy.
Now staff will wrap up their training on it this week, and then it will be immediately available for veterans to use. A veteran must come to the clinic and work with a clinician while they use it. We're live here outside the VA. Stephanie Sanostasi, News 13.